Hi everyone, welcome to a brief introduction to my project, Genetic Modifiers of Niclosamide Sensitivity and Resistance in Acute Myeloid Leukemia. In AML, some genetic change blocks differentiation and leads to the accumulation of immature blasts in the bone marrow and blood. There are numerous inciting events that can cause AML, making curative therapy difficult. Therapy for AML, including chemotherapy and stem cell transplant, is associated with significant morbidity and mortality. 30% of children with AML will experience relapse, of which only a third will be cured. For these reasons, more effective and less toxic therapies are required to cure AML. Our lab studies the role of a transcription factor called CREB in AML disease pathogenesis. CREB is a potential therapeutic target for AML therapy. It's overexpressed in AML and associated with poor prognosis. We identified a small molecule called XX65023 that inhibits the interaction between CREB and its activator, CREB binding protein. However, XX65023 does not have optimal physical chemical properties for clinical application in humans. Niclosamide, an FDA-approved drug widely used in the developing world in children to treat tapeworm infections, shares structural similarity with XX65023 and suppresses the proliferation of pediatric AML cells in vivo and in vitro by inhibiting CREB-dependent signaling pathways. Treating AML with one drug will lead to resistance. So understanding the mechanism of action and resistance of niclosamide is important. The aim of this study is to define the molecular pathways that mediate the effects of niclosamide in AML cells, allowing for more precise selection of patient populations for treatment, identifying potential sources of niclosamide resistance, and revealing combination therapies that make use of the distinct pathways targeted. To identify genetic modifiers of niclosamide activity and potential targets, we performed a CRISPR custom library screen. Our results revealed targets for combination therapy and potential mechanisms of resistance. Stop by my poster to find out more about the specific pathways involved.